Our health and social care system faces many challenges, and we rightly have lively political debates about all aspects of health policy. But sometimes problems are so deep-seated that when they surface, no one really believes they can be solved. Or even worse, we stop noticing those problems because they've become so much part of the fabric. Today I want to talk about one such problem, perhaps the biggest problem of all facing the NHS, which is the crisis in standards of care that exist in parts of the health and social care system. Just look at what's come to light in the last few years. Patients left to lie in their own excrement in Stafford Hospital, with members of the public taking soiled sheets home to wash because they didn't believe the hospital would do it. The man with dementia who was supposed to be monitored every 15 minutes who managed to leave a Pontypool hospital and drown. Isolated incidents? Well, sadly not. There's a simple test every layer of the health and social care system should be applying, and that is to ask, is this the care that I would wish for myself or for a loved one? Now, it's really important to stress that this is not the picture in most of the NHS or social care system. But the outstanding care that you see in so many institutions, even those under severe financial pressure, show why we must face these cases with anger and not with resignation. There are so many people who represent NHS values at their finest. In every fibre of their body, they care as they'd wish to be cared for. Nor should we make a false dichotomy between good treatment and good care. The King's Fund, generously hosting us today, has always championed a rigorous, evidence-based approach to healthcare issues. They know good care directly supports good outcomes. Vina Rally's work for the King's Fund this month showed the link between good care and good outcomes across GP practices, what she described as a strong association between patient satisfaction and clinical performance on the quality and outcomes framework. Consistent with this, a Lancet study in 2001 concluded that doctors who adopt a warm, friendly and reassuring manner are more effective than those who don't. So the argument is clear. Good care means healthier patients and stronger balance sheets. Yet too often this message isn't hitting home. So what are the solutions? Well, let's start at the top. We urgently need to strengthen corporate and managerial accountability for care provided. Yet too often managers have seen their priority as financial or clinical outputs. Incentives in the system have driven people to focus on quantitative input measures rather than the basic human right to be looked after with dignity and respect. Most managers get this. Indeed, their passion for the highest standards of care is why they've chosen to become managers in the NHS or the care sector. But many do not. Too many do not. And buried in spreadsheets, they become blind to the realities of what's happening day on day inside their organisations. It's this whole culture of ticking the box but missing the point, which is what we have to put right. But secondly, we need to know much more quickly where the problems are. Next year we'll roll out the Friends and Family test across the NHS. For the first time, hospital users will be asked if they would recommend the care they received to a friend or close member of their family. NHS staff will also continue to be asked anonymously whether they would recommend their organisation to their own families. This is the closest measure we can get to care as you would wish to be cared for, and we will publish the results. So it's a very important first step, but we need to do much more. Given the scale of the problems we're uncovering, it's now clear that we need to have a proper independent ratings system. It's not acceptable to deprive the public of the vital information they need or remove the pressure for constant, relentless improvement in standards. Now, I'm not advocating a return to the old star ratings, but the principle that there should be an easy to understand, independent and expert assessment of how well somewhere is doing relative to its peers, and that principle must be right. So this week I've asked for an independent study to be done as to how this might be achieved in a way that doesn't increase bureaucracy. The final and equally important side to all of this is staff development. The King's Fund and many others have shown that staff who feel engaged and valued in an open and supportive working environment deliver better care and support for patients. And yet, in these highly charged, busy, stressful environments, too many are left not waving but drowning, cut adrift from the help they need to do their jobs well. So what's in train to support those staff? New standards for senior managers issued by the Council for Healthcare Regulatory Excellence, echoing the need for respect, compassion and care for patients at the heart of leadership and governance. A leadership qualities framework for adult social care published by my department, which will do a similar job for care organisations. Next week we have the launch of the new vision for nurses, midwives and care staff, following the £40 million investment in leadership development programmes for nurses, midwives and registered care home managers announced by the Prime Minister in October. And next month, the establishment of the Professional Standards Authority to make sure the professional regulators do their jobs and protect the public effectively, and the beginning of a new era of medical revalidation, making our systems the best in the world for supporting doctors and ensuring standards. And then early next year, the first ever national set of standards and a code of conduct for health and social care support workers are published. So a lot is happening. And of course there will be those looking at this and saying, can we really do it? Is it realistic to expect organisations to invest more in people and the quality of care at a time when money is so tight? And there are indeed big financial pressures in a period of rising demand and flat budgets. But as the CQC said last week, most trusts and care homes deliver excellent care despite a tough financial environment. So there's absolutely no excuse for those that don't. But it is also wrong to equate better care with more money. More accurate would be to say what the King's Fund report today states plainly. It is bad care that costs more, including the £1.4 billion spent on unnecessary emergency admissions. In its 65th year, pitted against its biggest ever challenges, we need an NHS that is always searching, always improving, always striving to do more for patients. We take for granted improvements in medicine, in surgery, indeed in life expectancy. But none of this is real progress unless we're also treating our citizens with the dignity and respect they deserve. Widening the circle of compassion, denormalising the unacceptable in those rarer cases, and living the principle as care as you would wish to be cared for everywhere. The founding ideals of the NHS expect no less. Thank you.